Okay, here's my audience, my mom, my sister, and my sister-in-law. All right. According to the National Kidney Foundation, there are about 31 million Americans living with kidney failure today. That's 1 out of every 7 adults. 9 out of 10 of those people are already at stage 3 kidney failure but don't know because they have showed no symptoms. So as someone that has worked in the dialysis field and got specialized training regarding kidney failure, I really want to educate people on the causes of kidney failure as well as ways to prevent it, and if you are diagnosed, what those treatment options are going to be. So first we're going to look at the different causes of kidney failure. The leading cause of kidney failure is diabetes. This accounts for 44% of all kidney failure cases. The second leading cause is high blood pressure, which accounts for about 28.4% of all kidney failure cases. And then the remaining cases are caused from different genetic disorders like polycystic kidney disease or trauma to the kidney. And that can be any kind of accident or illness that causes that kidney failure. So once you know what the causes are, we can now start to look at different ways to prevent that kidney failure from happening. So most importantly is going to just try to be living a healthy lifestyle. Like I mentioned, 73% of kidney failure cases are caused from diabetes or from high blood pressure. So if you can really stay healthy and avoid those, so eating healthy, being active, not smoking, things like that, that'll help prevent that kidney failure. Also working closely with your doctor to manage any diseases or illnesses that you might have. So if you do have a genetic disorder that causes kidney failure, working with your doctor to slow the progression of that and to avoid that full-blown kidney failure. Or if you have diabetes, making sure that you're managing that with your insulin and things like that. It's also really important that you just know your family history. So if you have a family history of those genetic disorders, like that polycystic kidney disease, working with your doctor and getting tested as early as possible so that you can catch it early on and really slow that progression and keep yourself away from that full-blown kidney failure. So once you do, if you are diagnosed with kidney failure, there's different treatment options that you're going to be presented with. The most common is going to be some form of dialysis. The most common form of dialysis is going to be hemodialysis, which is what you see here. What's going to happen is you're given an access with your doctor. It'll either be a catheter in your chest like this or a fistula in your arm or thigh like this. There will be an arterial side and a venous side to both of those accesses. From that arterial side, we're pulling the blood out, pushing it through a machine like this, where that extra fluid and any excess toxins are going to be filtered out, and then your clean blood gets filtered back into your body. The second type of dialysis, which is less common in the US, but is actually easier on the body, is called peritoneal dialysis. With this dialysis, you're given a port in your abdomen right here, and then using a machine like this, that dialysis fluid is going to go into the abdomen. It's going to dwell for about 4 to 6 hours and then be pushed out with all of that excess fluid and that excess waste. This has to be done every single day for about 8 to 10 hours as opposed to 3 days a week for 4 hours on this. But it can be done while you're sleeping, so it's typically less disruptive to a patient's life. And because it's done over a longer period of time, patients usually feel a lot better when they're running on peritoneal versus the hemodialysis. The second type of treatment option is going to be a transplant. This is, of course, the most ideal for any patient. However, not everyone qualifies for a transplant. And in the US alone, we have 100,000 people waiting to get a kidney transplant, and we just don't have enough donors at this point. So patients typically start on some form of dialysis while they're on that wait list. And on average, depending where you live, you're waiting about 5 to 7 years before you can get that transplant. Once you do have that transplant, though, you can typically go back to a pretty normal life. You still want to stay healthy and take your anti-rejection meds, but those transplants can last 10 to 20 years. So you can have a really normal life for a really long time. And then, of course, the last treatment option is no treatment at all. This doesn't seem like it would be very appealing, but some people don't qualify for that transplant, and so the idea of having to be on dialysis for the rest of your life is just daunting, and they don't want to do that. And dialysis can also make you feel really sick, and so a lot of patients don't really want that feeling and would rather just have control over the remainder of their life and live it however they want to. We are seeing that kidney failure is a growing issue in the US. It's becoming such a huge problem that Medicare has developed its own program specifically for dialysis patients to pay for that treatment. Especially in the US too, with the rise in obesity and diabetes, we're seeing a lot more kidney failure happening. So it's really important that people are educated on it. Like I mentioned before, 1 in 7 adults is affected. So whether it's you or someone you love, chances are you're going to come across this at some point in your life. And the more informed you are, then the less daunting that diagnosis is, and the better questions you're able to ask your doctor moving forward. So it's just really important to know that it doesn't have to be a death sentence. You just want to be able to be playing an active role in your health, and making sure that you're being proactive and taking care of yourself. So that's it. So this is my audience again. My sister, my mom, and my brother's fiance, sister-in-law. Okay, thank you.